Coming up today, he kicked off his honeymoon ready to start his brand new life. But Dylan Meyer had no idea he'd come back to a devastating diagnosis. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Dylan Meyer had just walked down the aisle and was enjoying his honeymoon overseas when minor back pain set in. Within days of returning, Dylan went from newlywed to battling a fast-moving blood cancer that required rapid treatment.
This is the car I learned to drive stick shift on, so it's got a little bit of sentimental value to me. I will say there is nothing like a cancer diagnosis to break in a marriage.
Dylan Meyer had no idea the words "in sickness and in health" would be put to the test within days of his wedding.
Went on our honeymoon over to Italy, and I just woke up with a really bad back pain. Like, I just didn't want to get out of bed and just, laid there for a while. But, you got to soldier on because you're in Italy. You can't just lay around. And, I kind of thought it was just due to the big backpack we were carrying.
But the symptoms followed Dylan back to the States. Dylan, who was fit and an avid runner, was having trouble breathing. He decided to get checked out. That's when doctors discovered a softball-sized mass in his lungs.
I was always healthy, I ran, I worked out daily, I rarely had to go to the doctor for anything, and so it was really just, like a ton of bricks, for lack of a better term.
He was referred to the University of Kansas Cancer Center, where doctors diagnosed Dylan with acute lymphoblastic leukemia.
The immediate thing is, how does this happen? What did I do wrong?
Dylan underwent 30 days of intense chemotherapy, but was one of the 10% of patients who don't respond to this type of treatment.
I'd always told my doctors through the whole time, like, hey, if there's a decision point in which, we have to do something really hard and it has to suck for a little while, but I have a better long-term outcome, let's do that. That
would end up being a bone marrow transplant. His transplant team searched the bone marrow registry and found a match.
I mean, it's amazing. And I hope I get to meet the fella someday that gave me those cells and gave me life, honestly.
So far, Dylan is doing well.
This was kind of my gift to myself for beating cancer.
He's on maintenance medication. He's looking forward to more traveling and getting back to starting his new life.
We had gotten married, and less than 4 weeks later, I was in a hospital bed and in a hospital room for 30 days. It was eye-opening, and I'm thankful for my wife's support and my friends and family that came to help out through that whole time.
Well, we are so glad to have Dylan with us this morning. It's just great to see you.
Yeah, it's great to be here.
Yeah, are you feeling well, doing well today?
Fantastic, yep.
Well, we're great to have you, and great to have you alongside Dr. Anurag Singh, a hematologist and medical oncologist at the University of Kansas Cancer Center. Just great to have you both together.
Thank you. Happy to be here.
How long has it been since do you guys see each other very regularly?
Yes, so been taking care of Dylan for over 2 years. I think I saw him last week.
Oh, good. Okay, well, thank you for introducing to me, because it was such a pleasure to meet him. Dylan, I want to start with you and just go back to this story, because you're just a few days into your Italian honeymoon. I mean, how spectacular that is. And then this pain started. You were thinking, well, I'm carrying this heavy backpack around, and you're probably walking and doing all the sightseeing. Describe that pain, though. What did it feel like?
Yeah, so I think it was, the day we were in Modena, Italy. I just woke up that morning with a, back pain, and it was right in the center of my back, and I was like, man, this is awful. And so I went on that day. We toured Ferrari and Lamborghini, which I'm a big car guy, so it was awesome, but the pain just kind of kept getting worse. And I thought it was just, the backpack. So, after the honeymoon, then we got back home, and I was training for a half marathon. And I noticed my times just weren't where they were, and I just wasn't feeling great. So I went to see our on-site clinician at work, and she thought maybe I had bronchitis, because I had some respiratory symptoms. And she said, well, I'll give you this this medication, but I'd like you to go see the hospital, right? Something just doesn't make a lot of sense. So went over there and got x-rayed, and they were like, yeah, there's a solid mass, inside your chest cavity somewhere. And so they wanted me to come back. Fast forward to 3 days later, I did a 5K through work, and then the day after just wasn't feeling normal, just couldn't catch my breath. And so went into the ER that night, and that's where it all kind of got started at.
Well, and what I hear you telling me, you're young, you're fit, a healthy guy. I mean, so were you 30 at the time?
I would have been 29.
29.
Yep.
But you find out it's T-cell lymphoblastic lymphoma. I mean, probably not even a word even that would have popped into your vocabulary. How did you process that news, Dylan?
It was tough. I mean, one of the pictures that you showed was kind of when the doctor came in and said, hey, this is what you have, and I'm leaning on my wife because she was really the anchor for me through this all. It was a really tough time, but thank goodness for such a great facility right basically in our backyard with KU.
Well, we're glad you were here. Dr. Singh, what is it? What is T-cell lymphoblastic lymphoma? Why does it progress so quickly?
Yes, so it is a cancer of T lymphoblast. Now, T cells are one of our immune cells, and all of these blood cells are born in the bone marrow, and so T cells are born there as well. And then once they are mature, they leave the bone marrow and they go to this organ called thymus, which is inside our chest, where they grow and get the additional training that they need to fight infections. However, sometimes one of these early T cells, something happens to the DNA, and which turns these cells into cancer cells. And once they turn into cancer cells, they just keep growing without any control. And when they keep growing without control, they can, your blood can be full of these cancer cells. Sometimes these cells go to the chest and make these big masses, which can push on surrounding structures like heart and lungs. And so this is a very aggressive type of cancer, and progresses quickly, and untreated can be fatal.
Dylan had back pain. What other initial signs and symptoms might present?
Yes, so patients sometimes can have back pain, chest pain, pressure, fatigue, and sometimes they can have easy bleeding or bruising. Now, keep in mind, many of these symptoms are somewhat non-specific. So often patients do not realize. They think it is they're working too hard, or it's the backpack, and that's why often when they are come to medical attention, they have advanced quite a bit.
Yeah, back pain. Who doesn't have that from time to time? Right. Dylan, you started on chemo, right? What was that like?
Yeah, so it was a pretty aggressive regimen. It was basically every day for like 30 days, and I was in the hospital. Certainly wasn't fun, but I didn't personally have too many side effects from the first round, which is kind of indicative of, it ended up not working for me, right? So, I don't know if there's anything there, but it was certainly interesting.
So, Dr. Singh, then why do you think that the chemo regimen didn't work in this case?
Yeah. So, the treatment of these lymphoblastic leukemias is one of the success stories in oncology, where now, especially in children, where almost 80–90% of these cancers are cured just with chemotherapy. However, not everyone, and this could be because of many reasons. There are certain DNA damages which make the cancer more aggressive than others. So that is one of the. So now what we look at is the kind of DNA damage that someone has at the time of diagnosis. We also look at their response to initial treatment. And so if someone has an excellent response to chemotherapy, then they continue to get chemotherapy. It's a prolonged chemotherapy, goes for almost 2 to 3 years. But if those patients who have inadequate response to initial treatment, that indicates that their tumor is resistant to traditional chemotherapy, and you need to do more than just chemotherapy.
So when did the team realize a bone marrow transplant was the next treatment path? And are you already anticipating that to be the next plan?
Yes, so for all patients with this type of leukemia, once they're diagnosed, we start thinking about a potential transplant. So we identify a donor for them, and with the plan that if chemotherapy does not work, then we should be ready to go to the next step. So once Dylan had his initial treatment, repeat testing, including a bone marrow biopsy as well as scans, that showed that there was still a small amount of disease, which we do not or should not expect to see at that time. So that led to this decision making that we need to move to transplant.
So Dylan, what do you remember being told? You were part of that small percentage that chemo was not going to knock this out. Transplant was going to be the next step. What were you thinking?
That was scary. That was really scary. You know, very, very bad day that day, because I remember, you know, the doctor said, well, we're gonna put you on this maintenance chemo regimen for a little while, and you know, we're essentially going to try to get you into some clinical trials maybe, or try out some things to get rid of this cancer, right? And then about a month and a half later, they did another scan, and the maintenance chemo actually got rid of a lot of the disease. And so at that point, I think they decided to put me through the transplant. And that day that they told me I was going to be eligible for transplant was really it was a fantastic day. I mean, because I thought for sure that I was going to have to go travel to, you know, Lord knows where to get, you know, some exploratory regimen, and you know, then it turned out to not need to have to happen.
You could do it right here.
Exactly, exactly.
Well, we have some video of another BMT transplant that happened here at the Cancer Center. This was not your procedure, Dylan. I think the gentleman, though, in this video actually kind of looks a little bit like you, but it's not you. But Dr. Singh, what does recovery actually look like in the first weeks and months after a bone marrow transplant for a patient like Dylan and others?
Yes, so for transplant, first step is to give intensive chemotherapy along with some radiation. So Dylan got several days of chemotherapy and twice daily radiation. It's a total body radiation, and it is to kill cancer cells and wipe out his current immune system. And then after that, he received stem cell infusion, which are stem cells infused in the blood. And then we monitor for the side effects of the chemo radiation. So first 3 weeks are really rough because chemotherapy affects the lining of the food pipe from mouth all the way down. So nausea, vomiting, mouth sores, throat pain, diarrhea. So patients are quite sick. Often, you know, they require IV medications, they need IV nutrition, and so those first 3 weeks are really probably the toughest part of transplant. But then when the new stem cells start making new cells, and body starts to recover from the effect of chemo radiation, you start recovering, and then you are ready to get out of the hospital. So after that, we follow these patients very closely in clinic, where we have to monitor for infections, monitor their blood counts, monitor for immune reactions, something called graft versus host disease. So a lot of monitoring is involved, but the idea is that further they get away from transplant, the better they feel.
Let's talk about finding a donor. In this case, you searched the registry. Why was a donation from the registry the right choice for him?
Yes, so so when we are looking for a donor, donor is someone who shares their tissue type with Dylan. So now the best chance of finding a tissue match is with a brother or sister. But even a brother or sister has only 25% chance of being a match. Now, if you don't have siblings or they are not a match, then we look at unrelated donors. And this is a registry called National Marrow Donor Program, which has some 40 million volunteers on it who have given their DNA sample. So once we have patients' tissue typing back, we try to match it with the the DNA sample in the registry, and then so we are able to identify a young man who was I think 10 out of 10 match to Dylan. So it turned out to be a great donor.
Did you have siblings to check?
I did. I had two brothers, neither of which were a match, and all of my extended family also got tested, and none of them were a match either.
How often does that happen when you have two brothers and neither are a match?
So as I said earlier, if any sibling has a 25% chance of being a match, so
Just
3 out of 4 chance they're not going to be a match.
Just the way it rolls.
That's the way the genetics of this works.
So Dylan, you said it would be nice to be able to meet the fella, as you said, the nice fella who donated. What message do you have for somebody who randomly just said, I'd like to be able to get that call one day, and that he gets the call that he could save some guy, you, who he's never met? What do you say to someone like that?
I mean, I just, I'm eternally grateful to, whomever it is out there that donated, my new cells, and just in general for all of those people that go out and get typed and then get put in the registry. I mean, there are thousands of people like me that have to have this life-saving measure done, and without those people volunteering to go and get a surgical procedure done potentially to get their cells removed, I mean, I'd be dead. It's just simple as that, unfortunately.
Dr. Singh, how do you coach patients on preventing infection and protecting their immune system? They received this gift from someone, and now we want to make sure that they're protecting the gift and themselves post-transplant.
Yeah, transplant patients, their immune system is quite weak for a very long time after transplant. So yes, they are at increased risk of infections of all kinds, and when they get infection, it takes longer time for them to recover. So so we do provide guidance, and our patients receive a handbook with the do's and don'ts. Don't be around anyone who has cough, cold. Don't be in crowded places, and lots of hand washing and hand sanitizing, and then we also have our patients receive their childhood immunizations again after transplant, because all of the immunity that they had acquired is gone. So they need these immunizations again to protect them from these infections.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can also email the Medical News Network. That information is there on your screen. All right, you got to check out this video, Dylan. We have this video of you working out, to say the least. You've always been fit. What are you currently training for? Get ready to run again?
Yeah. So, my next goal is to do another half marathon in sub-hour 45 minutes. So it's about an 8-minute average. But I just finished up that video that you showed. I finished up with the 1,000-pound club at the gym. So it's essentially a 1,000-pound lift between deadlift, squat, and bench. So a combination of the three has to add to 1,000 pounds, and that lift shown was my last one to get there. That was a 395-pound deadlift.
All right, Dr. Singh, when you see your patients doing stuff like this, what does that tell you?
It's inspiring for all of us, because we have seen them go through a really tough time, and where they were so sick, and going from that situation to what Dylan is doing now, it's very inspiring, and where because our goal is for them to not just live but thrive and do things that they always wanted to do.
Okay, Dylan, a few weeks ago we had a patient, another BMT patient on here. He ran a marathon with. So now I'm wondering, I'm going to see a connection here. How many pounds did you lift?
So 1,000.
1,000. And how
yeah.
much was in that?
That was 395.
Dr. Singh.
Oh, that's well, who knows? Maybe Dylan. I'll get enough inspiration from Dylan to start lifting as well.
Let's start. Let's okay. We're a little lifting challenge for Dr. Singh.
Yeah.
All right, I love it. Let's talk about Tori. All right, your lovely wife, who I know has just been there for you. She's here with us this morning. How did you two get through this together?
It was a heck of a way to start a marriage, if we're being honest. Like you said, the for better or for worse really came true, and I got to see the worst side of what life might bring, but I was accompanied by someone who was completely supportive throughout the entirety of it. I mean, my wife was working full time while also then coming down, and I had to be under constant care during the transplant, and she would work 12-hour shift and then drive down to Kansas City to be with me in the Airbnb that we were in or at the hospital. And I couldn't have done it without her and all the other family members that I had and friends that supported me.
And she's a police officer?
She is,
Kansas City, Kansas police officer?
Yep. Yep. So she, it's not easy work that she does, and so to do it for 12 hours and then, have the emotional burden of, answering all of my concerns and fears, I can't imagine what she had to go through as well.
How important was it though, just to have for someone going through something like this, just having that support at home, in the community? What did that mean to you?
It meant the world. I mean, had I not had the support system that I did, I wouldn't be here. We talked about that a lot when I was going through it, and it's like even just sitting at home, like if I had a cough that would start, or like a fever that would pop up, someone had to call the BMT clinic and be like, hey, is this a worry? And if so, they had to take me over to the hospital because I couldn't drive, and so I was dependent upon her and then the other folks that took care of me.
So we often talk about the hardest part of the cancer journey, but you were so positive. I remember sitting in your garage with you in front of that car, that cool car. But I have to ask you, what's been the best part of this? Because you seem to just make the best of everything. So I have to ask you, can you talk about something that's been the best part of this so-called experience and this journey for you?
I've made a lot of new friends through it all. I found people that went through the same thing that I did years ago, and I was able to lean on them when, I'd have a random thing that would pop up. I'd message them or call them and be like, hey, did you have something like this? And they'd always be like, yeah, it sucked, but it went away after a while. And the relationships too, like with Dr. Singh. Dr. Singh is a fantastic person, and I'm thankful that he chose the line of work that he did because, like I said, without him and the rest of the care team, I wouldn't be here without them.
Dr. Singh, what does 1 year out typically mean in terms of risk, strength, long-term health for a patient who's gone through a transplant?
Yeah. So 1 year out, it's a big milestone because transplant is a front-loaded process, and a lot of major complications we see them in the first year. So if someone is alive, cancer-free at 1 year, they definitely have a much better chance of being cancer-free and without significant problems down the road. Now, I would say that transplant survivors, they have some unique risks. So even when they are 1 year out, they are at increased risk of infections. They are at increased risk of other health issues, especially someone like Dylan, who is young. So we hope for many decades of good health. So we have to make sure that we do everything to keep him in good health for many more decades. So for these patients, we also have a survivorship program where we look at all the treatments they have received and the unique risks that they are at, and we make sure that we do all the preventative measures and to make sure that they stay in good health.
Well, we want to get to some questions from our viewers this morning. And Angie wants to know what causes TLBL. Are there known risk factors?
So most of the time we do not know. These cancers are mostly random, and very small percentage of patients may have some inherited risk factors which increase risk of this cancer, but most of the time these are just random events.
Patty wants to know what's the difference between a bone marrow and a stem cell transplant. We often refer to them kind of in the same way.
Yes, so what we are transplanting are the stem cells. So the difference is where the stem cells are acquired from. So stem cells, you could get them directly from the bone marrow, which is a surgical procedure where done under general anesthesia, where you insert needle into the hip bone and collect stem cells from there. The other option is to give medications to move the stem cells out of the bone marrow into blood, and then connecting the donor to a machine, which is it's like blood donation. So now these days, almost 80–90% of the stem cells are collected from blood. 10–15% of the times we collect from the bone marrow. Both of these stem cell sources have their own advantages and disadvantages. Generally, with in young patients, and especially with unrelated donors, we prefer bone marrow when we can.
Question for you, Dylan. Amy wants to know if you did any or were able to do any family planning after your diagnosis, since you were so young and just married.
Yeah. So, that was a big part of going into it. It was very rapid fire, right? I got diagnosed, I think, late October, and then by the first week in November, they were wanting to start treatment. So it was we had about a week to figure out what to do there, and the care team was fantastic in helping plan for that. So we were able to do the banking option for me to preserve my ability to have children in the future. And the team did a great job of identifying that and getting on it immediately.
That's a lot, Dr. Singh. I mean, you've just been diagnosed with cancer, and you're trying to decide on treatment options and things, and now you're trying to do a quick family planning session. How do you talk to patients about that?
Yes, it is challenging, but again, we know that it is important. So we try to make sure, especially in young patients, that we discuss with them the options for fertility preservation, which for men, sperm cryopreservation, or for women, egg preservation. And sometimes it's challenging because, as you heard, they are getting chemo, and you cannot do these right in the middle of chemo. So you have often just a small window where you can do the fertility preservation before you proceed with transplant, because transplant can cause temporary and sometimes permanent infertility.
Molly is asking, how do you become a donor on the list? How do you get on the list?
So it's very easy. You can go to National Marrow Donor Program's website, NMDP, and you could be a donor. Now they are looking for young, healthy, preferably male donors. But anyone can, anyone young can go on the registry and sign up to be a donor.
So Tony had a question. Yeah, how does the donor match work, and who makes a good match? So anyone can make a good match.
That is correct. Again, when we have multiple donors, we do look at many other parts like their age and sex and blood type, etc. But the techniques of transplants have evolved, and in 2025, anyone who needs a transplant, we are able to identify a donor for them.
A question from Sarah is, what factors determine whether a patient is strong enough for a transplant?
Yeah, it's a great question. So, transplant is not easy, and it's you have to make sure that they are in good shape to go through the process. So we do a lot of testing before transplant to make sure that our patients are in good shape or there are no problems which would significantly affect the success of transplant. So we have, we check their heart function, lung function. In fact, in our program, we have a comprehensive sort of battery of tests where to look at their physical function, cognitive function, their psychological status, their food situation. We look at all of these things to make sure that we can identify any problems and we can optimize them before, during, and after transplant.
Before we head out, Dylan, now that you're considered technically cancer-free, is that fair to say?
He's in complete remission.
Complete remission. We'll take that, right? What is on your list of things to do as we head getting closer to the next year?
Yeah, so I like to challenge myself at all times, and so I think the next thing is that half marathon. I'm always pushing myself at work, so trying to identify new projects to work on and kind of force myself to get better in that regard. And then, also thinking about family in the future. We're both excited to have a family to grow with here in the future.
Well, keep us posted. What do you want the big takeaway from your story to be?
Really just, anyone who's going through this, stay positive. It's really tough to do so, but stay positive and, try and develop that support network. Without the people around you, you won't be successful doing it yourself. So the more you can lean on those folks around you, I think the more successful you'll be.
Great message. Thank you so much for sharing your story. So good to see you again. Dr. Singh, what's the big takeaway today?
Yeah. So again, these are aggressive cancers, but they are potentially curable. So it is important to not ignore symptoms. Once you're diagnosed or a family member is diagnosed, find a good team and then make sure that while you go through treatments, you stay active. Make sure that you eat healthy, and again, take one day at a time. That helps you go through the process and ultimately results in success.
Thank you both for being here with us today. Thank you to our viewers for being with us. Coming up tomorrow on All Things Brain. The sound you are hearing is a cowbell, and it turns out cowbell is the answer for this patient's problem. Find out Monday what researchers hope to discover with this exercise.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.